First, we're going to apply the headset and make sure it's comfortable. My name is Dr. Renée El-Gabalawya. I'm an associate professor at the University of Manitoba. I'm cross-appointed in the departments of clinical health psychology and anesthesiology, perioperative and pain medicine. We had taken that original prototype that you had seen and we developed it further to allow for being wheeled into the OR. My clinical practice is focused on medical trauma and adverse health events, and I saw a lot of patients coming in that were really highly anxious, and I started doing a lot of research in the area, and some of my own research has shown a really strong relationship between anxiety before surgery and complications after surgery, increased rates of rehospitalization, length of stay, quality of life, things that really matter to both patients and the system as a whole. I played around with it a lot. Yeah.
Thank you.
The idea was, can we develop a virtual reality program that uses scientifically supported methods and treatments to be able to better support patients? For me, it was really important, though, that all the ideas didn't come from me and the literature, that it also came from patients and people with lived experience. So this will be a tour of the actual hospital environments. So we ran a number of studies where we built an initial virtual reality prototype that exposed people to the operating room environment.
I'm going to ask you to lie down now. Just put your head on the pillow and relax into the bed.
Like, this just feels very relaxed when the doctors are speaking and just explaining things.
Michelle has been an incredible part of this research journey. She was actually originally a person in our large feasibility study that trialed our prototype prior to her mastectomy.
It's time for your oxygen mask. Can I get you to put your head back on the pillow and look straight up at the ceiling?
She gave us all this feedback. She filled out questionnaires. She gave us verbal feedback throughout that whole process, before surgery, after surgery. She trialed it about 1 week before her breast cancer surgery. And then we invited her back later on to participate in focus groups. So there are groups of people who participated in that initial study to kind of talk about what they like, dislike, how we think we can grow the virtual reality and make it better. I'm gonna just take it off, Michelle, if that's okay.
Sure.
Okay.
Thank you.
Yeah.
That was really powerful. It felt very real. Like, having gone through surgery and seeing the operating room and meeting the doctors and seeing the equipment, this was very helpful because it was what I experienced in real life.
I did a lot of my training in the US and I had some exposure there and some, I actually was inspired through the military virtual reality in terms of deployment. That's where I sort of, that was a real inspiration for me, is that they're preparing military personnel for deployment using virtual reality, right? So why can't we do the same thing with this really stressful medical experience, surgery, which is very traumatic and anxiety provoking for patients?
I'll let your medical team know that you're awake.
What we really see in our system is there is a great need for mental health support. And unfortunately, the resources are limited. That is no secret. And so we need to be thinking about innovative solutions. I think psychologists are in a really unique position because we function as clinician scientists. So we're trained as both researchers and clinicians to be able to develop this type of intervention to be able to support these patients. And I really have a lot of interest in sort of stepped care models. I see the value that, yes, you might need a psychologist for more severe issues, more complex issues, but if we can provide large support to a large number of people, then we can reserve our time and be able to really treat the people who need it the most.
The anxiety is high, like, for anybody going through some medical procedures. And so if there's any way to just help yourself to, like, breathe through it and realize that this is okay, we're gonna be okay. It is, I don't know, I can't put it into words really, the feeling that's there. It's relief.